We are so excited to have students returning to the classrooms. However, we felt it was important to share some health reminders and new procedures that all families will be asked to follow. Remember that wherever you go, you should always follow public health guidelines, including the 3 Ws, to reduce your risk of getting and spreading COVID-19. Wash your hands, wear a mask, and watch your distance.
Washing your hands is easy, and it's one of the most effective ways to prevent the spread of germs. Wet your hands with clean running water. It can be warm or cold, and apply soap. Lather your hands by rubbing them together with the soap. Wash the fronts and backs, wrists, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. You can sing the ABC song once, or the Happy Birthday song twice. Rinse your hands well under running water and then dry them with a clean towel, or air dry them. Turn off the faucet with a towel. If soap and water aren't available, use an alcohol-based hand sanitizer that contains at least 60% alcohol. Apply the sanitizer and rub your hands together until they're dry. This should take about 20 seconds. Wash your hands before you eat or touch your face. And after you use the restroom, go outside, blow your nose, cough or sneeze, or touch your face covering. Remember to follow everyday healthy habits. Wear a cloth face covering, stay 6 feet away from others, and stay home if you're sick. If you have any questions, contact your school nurse, working on the front lines of the COVID-19 pandemic in schools. It's important to wear cloth face coverings when you're out in public and around people who don't live in your household. Face coverings act as a barrier to help slow or reduce the spread of COVID-19. Check with your school for information on face covering policies. Wash your hands before putting on your face covering. Put it over your nose and mouth and secure it under your chin. Fit it snugly against the sides of your face, but make sure you can breathe easily. Don't put the face covering around your neck or on your forehead, and don't touch it. If you do, wash your hands. Never share or swap face coverings. When you get home, carefully take off your face covering by stretching the ear loops or untying the strings behind your head. Fold the outside corners together and put it aside for washing. Then wash your hands. Cloth face coverings should be washed and dried after use each day. Label your face covering with your name or initials. Bring a backup in case it's needed. In addition to wearing cloth face coverings, remember to follow everyday healthy habits. Wash your hands often, stay 6 feet away from others, and stay home if you're sick. If you have any questions about wearing a face covering at school, contact your school nurse, a trusted resource for students, parents, and staff. If you're sick or think you might have COVID-19, it's important to stay home and away from other people. Some of the symptoms to watch for are cough, fever, sore throat, vomiting, diarrhea, loss of smell or taste, headache, tiredness, and muscle pain. Most people with COVID-19 have mild illness and can recover at home without medical care. Manage your symptoms by getting rest and drinking plenty of fluids. Cover your coughs and sneezes with a tissue. Wash your hands often with soap and water for at least 20 seconds. As much as you can, stay in a specific room, away from others who live with you. Avoid sharing things like towels and dishes. Stay aware of how you feel. Contact your healthcare provider if you're worried about your health. Call 911 if you're having difficulty breathing, staying awake, chest pain, or blue lips. When can you go back to school? That depends on different factors. Check with your school to find out specific policies. If you had close contact with a person who has COVID-19, you should also stay home or quarantine for 14 days and monitor your health. If you have any questions, contact your school nurse, the healthcare expert at your school.